Hello, my name is Jose Miranda Velasquez, and I'm going to demonstrate the IV fluid and medication administration video for BSN 266. I'm going to start by performing hand hygiene, donning my gloves. All right, we have gathered our supplies. And then we have the primary fluid verified with the doctor's orders within the MAR. After that, we're going to verify the 5 rights of medication administration, which is the right patient, the right dose, the right time, the right route, and then the right documentation. For our primary tubing, we have the micro drip set. So we get the 15 drops per minute. And then we have a medication piggyback. Our doctor has prescribed 250 milligrams of amoxicillin to run over 15 minutes. This is supplied in a 100 ml piggyback bag. 100 ml piggyback. And for that, we would also verify the 5 rights of medication administration, which would be, again, the right patient, the right dose, the right route, the right time, and then the right documentation. As well as we have verbally confirmed with our patient as we have access to the chart. And we want to just check with them that they have no allergies to amoxicillin. For that, we have a secondary set, which is also a micro drip set, which would also give us 15 drops per ml. And then we have our alcohol prep pads for our piggyback hanger. So we're going to start with our calculations. So for the fluid order for 150 mLs per 60 for the hour or over an hour, which would be the 60 minutes at 15 drops per ml, would give us 38 drops per minute. For the amoxicillin, it was ordered 250 milligrams, which would be 100 mLs over the 15 minutes with our micro drip set tubing. At the 15 drops per ml would be 100 drops per minute essentially. And we will spike our and prime our primary infusion. So we'll take our tubing and go ahead and do the spike. So this portion here, this is still capped, is to remain sterile. This is the part that we would introduce into the bag. And then we have the drip chamber, and this would help prevent the air from entering into our tube, as well as it allows us to visualize our flow rate. Down here we have our roller clamp. This allows us to adjust the flow rate. So we're going to start with it in the position off. And then down here, we have our Y site. This is the medication administration via piggyback IV bolus for the secondary infusion. Anytime that we use this port, we need to make sure that our medications are compatible to be able to infuse together. Finally, we have our adapter end, and this end that is the one that goes into the IV site. So we'll go ahead. I should have it correct, which is our 250 ml. This is the IV solution that we're starting first. Want to remove the top there. And then again, this part is to remain sterile. Remove the top. And then go ahead and introduce that into the bag all the way in. And we have our spike of the IV bag. And since I know that I'm going to be doing a piggyback, have my hangers here. I don't know if they can be seen. So I'm going to go ahead and get my end. Sorry, bear with me, the hole's not really punched through. There we go. And so we're going to place that ideally on a lower hook so that we know which one's which. And then we're going to squeeze the chamber until half of it is filled up with fluid. Okay. Then we will slowly open the roller clamp until the fluid has begun filling our tubing, and then no air bubbles will be present or that are present. Okay, then we're going to close it. Next, we're going to use our alcohol prep pad. Sorry, got lost there. We're going to clean our patient's IV site and the saline lock. We're then going to give it a minute to dry. And then we're going to go ahead and attach our primary tubing. Then we're going to slowly open the roller clamp and we're going to count our drip rate. Our primary infusion, we need 38 drops over the minute. So we will time it and adjust the drip rate or the flow at this time. And then we will count the whole minute to verify that we have the accurate infusion rate. Okay, so we are at 38 drops at a minute. And in the real world, I would allow and let this infusion to continue. But due to the limited supplies, I'm going to start the infusion now. Pardon, I'm going to stop it. Then I would set up our piggyback, our IV piggyback. We have the amoxicillin. And then this is the secondary line. You know, we want to start with the roller clamp closed. tip and insert it into the bag. Okay, just like so. We're gonna go ahead and hang this one above our primary, so higher up. And then we're gonna verify that both bags are at least 30 inches above the IV site. And then we're going to go ahead and squeeze our drip trimmer to half full. And then we're going to slowly prime our line by slowly opening the roller clamp so that no air comes in, but it also allows the air and the bubbles to exit out of the line. Once it's bled, we're going to close the roller clamp, and then we're going to take a new alcohol prep pad. And then we're going to take our Y side and clean the side with our alcohol. We're going to remove the caps and then attach it. And then we're going to attach our secondary tubing to our primary tubing like such. Then we're going to go back to our clamp, and then we're going to open it slowly at a rate of 100 drops per minute. So we're going to slowly open the clamp until we reach 100 drops per minute, and again, we want to count for the full minute. Okay, so 100 drops per minute. At this point, we're going to verify and reassess our patient's IV site. We're going to look for any signs of infiltration, any pain, redness, or swelling at the site, in which case we would turn off our infusion. Since the amoxicillin is a moderately high-risk allergy medication, we will hang out with our patient and watch our patient for a little bit for any signs of hypersensitivity reactions or anaphylactic signs or symptoms as well. At this point, we're going to place our patient in a position of comfort. We want to ensure that the coli is within our reach. We're going to go ahead and remove our gloves, discard our supplies, perform hand hygiene, and then document our procedure. Thank you very much.